Well, I'm recording the whole thing, so if you guys want, I can definitely send it over to you guys. Yeah? Yeah. All right. Relax everything. I'm going to kind of move the ankles just a little bit here. Going to bend your knees. You might feel a little bit of a stretch, maybe some into the lower back too. Any stretch over the quads right now, the front of the thighs?
Very little, only on the left side.
On the left side. Do me a favor, squeeze your butt like as if you're tucking your tail between your legs. That might amplify that stretch a little bit.
Oh yeah.
Oh yeah. All right. Okay. All right. Do see a little bit more inverted ankle on that right side versus the left side. All right. So we're going to keep your right leg fully straight, and you're going to lift your entire right leg off the table.
Okay.
Right. There you go. Okay. Any pain or any discomfort there?
No.
All right. You can go and put the right leg down. Let's move on to the left leg as well. All right, good deal. All right, can I get that right leg one more time too? Okay, perfect. All right. Now, when I press down on the right sacrum, is that painful, tender?
No.
No.
I can actually feel it opening up a little bit when you did that. It's kind of.
Gotcha. And if I do that same thing for the left side, any pain, any tenderness?
No.
No, that's good. We're gonna move into the lower back. Any pain there?
No.
No. Any pain there?
Nope.
No, that's good. All right, good. As I press down, there's no pain in the front of the ribs, right?
No.
Okay. Oh yeah, I can definitely feel that on the right side for sure. You feel that too, right?
I'm just so used to the tension.
Yeah. Okay. All right. I'm going to kind of do the shoulder thing to relax your arms. I'm going to lift them up here. Any stretch as I do this? Are you feeling any stretch in the armpits or in the top of the shoulders?
More like in the armpits and the lats.
Okay. You feeling it more on the right or the left?
Equal.
Equal. Okay. All right. All right. So, I'm ready to start my first series of adjustment. You ready?
I'm ready.
All right, my friend. Take a long, deep breath in. And we're going to sink the spine down as you breathe it out, yeah? There you go. Let that fully sink in. Good. Let that fully sink in. Good. Same. Good. And let that go too. Excellent. All right. Relax this part of the shoulder. We're going to separate your head away from the shoulders. Here we go. We already got one crack in. Good. A little bit on this side too. Give me 1 second there.
You need to loosen the button? Or?
No, you're good. Let the neck fall through. Excellent.
Yeah.
Oh yeah. I got a little bit more on that right side, okay? Just let your head go. Tuck your chin in for me a little bit. Yeah, there we go. We're going to let the head fall off to the side. It's just going to be a gentle push there. Good. Same for this side. Then open up that right side. Let that muscle go. There you go. Oh, yeah. Do me a favor. Turn around. Lay down flat on your back for me. Scoot down a little bit. Perfect. Okay. Now, give yourself a hug for me. I want to see how the shoulders are. Can we get that one underneath, like kind of like a bear hug? All right. Now relax this one here real quick. If I do that, is that causing any pain?
Not pain, but a little bit of a dull ache.
Okay. All right. So let's do this here. I'm gonna probably get to the right shoulder first. Okay. You're gonna cup your right ear with this one. There you go. Already clicking a little bit. All right. So we're gonna pull the scapula out. Okay. Here we go. Maybe put the mic there. Now, let my hand just kind of dig into the armpit here. Take a deep breath in. As you breathe out, let your shoulders sink through. I know it's not the most comfortable. Wiggle your toes for me. A little bit more there. There it goes. There it goes. A little tender?
Yeah.
Yeah, I know.
Oh, good.
Yeah. Gonna kind of get to the elbow too here. There it is. A little bit this way as well. Good. And you kind of turn it around, get that radial head. Good. Keep that the wrist relaxed. Good. A little tenderness there. It's already popping and clicking. Good, 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 good. Thanks. Good. 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 A little bit more relaxed on the ring finger. Good. Excellent. All right. Once you slide the body just a little bit over to the right, let's get that left shoulder to release too, yeah?
Okay.
So we're gonna cup that left ear. Good. We're gonna kind of roll the... All right. Deep breath in the belly. As you breathe it out, let your shoulders sink through. Yes, sir. Not the most comfortable, I know, but try to relax the joints here. Hold the muscle. Wiggle your toes for me. Wiggle, wiggle, wiggle. One more time. All right. Ah. No.
It hurts.
Yes, sir. Good. Let the elbow relax too. Good. A little bit of rotation there. Okay. It's already popping. Good. Excellent. Relax the thumb. Index finger too. Excellent. Ring finger as well. There you go. Very good. All right. Give yourself a hug. Let's see. If I were to maybe switch the elbows. Okay. All right. This one might hurt the shoulders just a little bit, but I want to kind of release that low mid-back tension.
Okay.
I'm going to kind of go through a crunch together. Let your body go. Let it relax back.
Okay.
Pulling the shoulders back are going to help, but I'm going to kind of guide you through it, yeah?
Okay.
Okay. All right. We'll be putting a lot of weight on there, so actually let me see if we can maybe do this. Is probably going to be a little bit better. Hug this pillow for me. Yeah. Yes, sir. Like a tight squeeze though, yeah? Yeah. There we go. Lift your head up. There we go. We're going to go through a crunch together. 3, 2, 1. Deep breath in the belly. As you breathe it out, let your body roll back. Keep it going. Keep it going. It's going to definitely open up with ring finger for sure. All right. Let me have the pillow. All right. Scoot up a little bit. That way. Good. Relax your knee, relax the leg. Let it fall through. It's got a nice little pressure there. There it is. And we're gonna keep the leg super relaxed. Nice little pull to get the hip relaxed too. Yeah, excellent.
Oh yeah.
Oh yeah. Same for the left side. So, just let the knee go. There it is. Good. Okay. Let the leg fall all the way through. Okay. Nice. All right. Let's go ahead and head on to the other room. We're going to get your ring finger going. We're going to wrap a wet towel around the neck. This is going to give me a little bit more grip. The pins are the hardest part. I'm going to try to get it as tight as I possibly can. Sometimes on that first pull, we won't get much, but the second pull we'll get a decent amount. So if I do pull and you didn't feel much of it, let me know and I'll do a second pull as well. Okay? Do me a favor, lay down on your back. All right. Okay. Yeah, that's pretty good right there. I'm going to kind of attach the mic to you here. The tighter the pins, the better, okay? So keep your muscles, your abdomen as relaxed as you possibly can so that way we can get a nice tug sensation. You ready?
Yep.
Here we go. All right, you can go in place. Yeah, there you go.
Even that feels good.
Yeah. Keep the teeth together. Don't bite your tongue. All right, we're going to wrap the towel around this way. And we're going to wrap the towel around this way too. Long, deep breath in the belly. Yes, sir. We're going to go a little bit longer. There you go. Yes, sir. Do you feel it going all the way down?
It went all the way down.
Good. Good.
Still kicking.
Yes, sir. Yes, sir. Absolutely. Lift up your head gently. All right. You can go and let the head go too.
Okay.
I'm going to kind of maybe open up the neck just a little bit more on that, especially on that right side. Wiggle your toes for me. Good. Same on this one. Yeah, just let that muscle go a little bit more. Good. Not much there, huh? All right.
It's weird. I was expecting more cracking on this side, but it's all coming from the left.
Yeah. Well, we did pop a couple of segments up when you were in the other room too.
Yeah.
So, all right. So, keep your eyes closed. Yeah, we're gonna go through those sensations one more time. Yeah.
Okay.
You ready?
Mm-hmm.
So we got 1 and 2. Do they feel the same?
Yes.
1 and 2.
Yes.
1 and 2.
Yes.
Good. 1 and 2.
Yeah. Same.
Nice. 1 and 2.
Same.
1 and 2.
Same.
Good. Awesome. All right, man.
Just glad I'm not as in much pain. See, that's the other thing I always do is I cross my leg
Yeah.
and sleep. Try to get a little more tension on that, but
Yeah.
it's
We're gonna
habit.
do a nice little leg pull one more time, just so if there's anything left within that hip and the lower back, it'll release it still a little bit more. Good. Tiny little bit, not much though, huh?
Yeah.
Same on that left side. Keep it relaxed. Let that go. Turn the head to the right. There you go. That's good. Very nice. All right, can I help you up?
Yeah.
Yeah. All right, I'm checking that off too. All right. Good stuff, man.
Yeah.
Welcome to your first ring ding.
Thank you.
Yeah, of course. It's my pleasure.
Yeah, that was awesome.
Good stuff, man. Good stuff.
And I'll be able to walk around Anaheim Convention Center for the next 3 days, logging thousands and thousands of steps.
Yeah, of course. Make sure you drink plenty of water. We just opened a lot of joints up, right? So keeping your body well hydrated is going to help with the muscle tonicity. Let's talk a little bit about the shoulder. One very simple, and you can actually do this at home. Get a towel, obviously not a wet one, but you want to have a neutral wrist, right? So I don't want you to hold the towel this way or this way. I want you to hold the towel in this direction. And all you're gonna do is, obviously my towel is a little bit too thick, but about shoulder width apart, you're just gonna pull the towel away, yeah? Don't let your shoulders hike up. Pull the shoulder blades down and you're gonna pull. This is gonna be really target a very specific muscle group, mainly the deltoids and the supraspinatus, which is a very tiny muscle fiber within the shoulder blade. Also, one more exercise that I want you to start doing is you're gonna put your hand and interlace your fingers behind your back. You might already feel some tension within the shoulder blades when you do that. Once you got your hands interlaced, you're gonna apply a nice 10% pressure into your back, and then you're gonna start to pull the elbows back and forth. This is going to open up the shoulder joint. And then from here, you're gonna stabilize the elbows now, and then you're gonna start to roll the shoulder blades in a circular pattern. You can go clockwise and counterclockwise. Whichever direction you feel like I can pull it forward or I can pull it backwards, the more you start to practice and implement those two movements, the more blood flow you're going to have into those muscles. So over time, they're just gonna become a lot stronger, and you're gonna have that full rotation back into your shoulder blade. That's gonna relieve a lot of pressure on the right side of the neck and the shoulder that you're having some pain. Although that's not a pain that is constantly there, but that's gonna open up a lot of things. Also, you got your lats that is actually targeted within that position too, because you put your arm in this position. Because the lats is touching your hip bone, that's going to take some pressure off your right side lower back as well. Last but not least, for the right side of the body, there's two things that are happening. The left glute, as I had you extend your legs back, some part of that contraction delivers back into the right side. This is what we call the cross chain here. So what's lacking here will compromise itself on the right side, right? Two things I want you to do. Number one, I want you to, for sure, load up your left leg more regularly when you're going from a sit to stand position, yeah? Especially in the car, when we're driving, and as soon as we're trying to get out the car, we're gonna put this leg up and then we push, right? So that's a good time for you to really load that leg first. But because the right leg is kind of stuck in the car, that's just gonna be a very uneven pressure. So when you are getting out of the car, get that right foot out of the car as well, and then load the legs up equally, right? But when you're at home or something like that, where you're like sitting on the couch or a chair or something, just keep a nice pressure over that left side of the leg. You know, you don't have to lift your leg up. I mean, if you want to, you can, but definitely load that left leg first, and then, you know, go into your standing position.
Okay.
Sounds good?
Yeah. See, I was getting more when you said that. It just reminded me that someone said that if you have a lot of pain on one side, it's usually coming from the other side.
Yeah, yeah.
I'm like, I don't know about that. I mean, it makes sense that the other side's locking up to compensate for something with the other side.
This is the reason why even when we walk, like, you know, your opposite hand and your opposite leg cross, right? Yeah. So we definitely do have that cross chain, but it really depends on which part of the body is underactive and overactive, right? So a lot of times when we're trying to extend the hip, that extension is not quite open because the leg is positioned in that flexion for a long period of time. And because it cannot do that, the paraspinals and everything into the lower back will tuck the pelvis upwards a little bit to open up that space.
Feeling a little bit more in my foot, the more and more. It's just sitting here, I feel more feeling in the bottom of my foot.
Good.
And in general.
Good, yeah. Give it a couple more days. You're gonna start to, like I said, that 2 days after the adjustment, your nerves are gonna start to be like, whoa, we just had this space open up. And it starts to balance out the neurotransmitters that are sending out through the spinal canal. Yeah. And hopefully a little bit more balanced. Yeah, that's it, man.
Perfect.
All right, good.
Thank you
good
so
stuff.
much.
You're very, very welcome.
Appreciate
it's my pleasure.
This
Of course. Of course.